Heel pain is something that's been occurring and is increasing in frequency. As our society ages, as we're trying to become and stay more athletic and trying to stay active, heel pain has become a major problem in America. In fact, over 10% of the population each year is afflicted with this condition. And the symptoms tend to be relatively consistent. The pain seems to be most prevalent in the morning after sitting, and then after any periods of sitting. But what happens is, as time goes on, the pain does tend to intensify during the day. And from my perspective, where it's important to have this treated is not only because of the pain that it causes, but also because of the change in gait. And what I find is that the foot, as kind of the primary support system for the body, when the foot, or especially the heel, which is your primary shock absorber, is no longer functioning properly, inevitably you compensate. And a lot of times the compensation becomes the main problem, whether it be a knee problem, hip, lower back, opposite leg. We see patients with TMJ because they've lost shock absorption ability. So in my estimation, it's a very, very serious problem, and it requires treatment. Most people do try to treat it conservatively at home, and for a lot of them, it's effective. They'll roll they'll roll their foot over a Coke bottle, they'll apply ice to the area, they'll stretch, and there is a significant group of people that will help to improve the condition, but unfortunately not for everyone. We have been treating this condition extensively for a long time, and there's very good treatments for this condition. Most people get better conservatively. Generally, it requires several treatments. It may require inserts, some form of splinting, stretching, but the long-term prognosis is excellent for this condition. For those that don't improve, and it is a small subset of people, we have just acquired a new technology that is non-invasive, that is actually from Switzerland. We're the first group in North Carolina to have it, and I'm very excited about this treatment. It's a high-energy shockwave machine, and basically what it does is it stimulates the body's defenses to solve the problem, and that is for cases that we cannot solve with some relatively simple conservative care. For those that don't respond, there is a surgical solution, but the good news is it's for a very small subset of people. But I do think that in evaluating this condition, it's important not just to think about the heel, but most importantly to think about the compensation for that problem.